This is Shelley Kraft coming to you live on SNNLive. We're at the SEMDA conference, Southeastern Medical Device Association 2014 here in Atlanta, Georgia. I have with me Mr. Robert Arkin of Sensiotec, a private company. And by the way, I want to welcome you back, Robert. Welcome back to SNNLive.
Well, thanks for having me again. I appreciate the opportunity.
It's my pleasure to have you. Let's get an overview of Sensiotec for our audience, please.
So Sensiotec has built a cardiorespiratory platform that can measure heart rate, respiration rate, patient presence, and movement. We call this platform the Virtual Medical Assistant. It's the world's first FDA-cleared radar-based technology that is actually acquiring cardiorespiratory information on a continuous basis and patient motion information.
So you don't have to wear sensors?
No sensors, no wearables, no bracelets, no nothing. It's a completely transparent solution. What it means, of course, then is that the system is automatically compliant because the patient doesn't have to do a thing. So it's comfortable, compliant, and labor-saving.
How does it work?
The way it works, it really starts at the point of care. At the point of care, we have a point of care device, which is a sensor panel. The sensor panel is sending out radar signals every 2 nanoseconds. Those signals go through any surface except solid metal, penetrate the patient's body, and actually measure the micro movement of the patient's heart, lungs, and torso. That data is then returned from the patient in the form of a reflected signal to the sensor panel, and we have an onboard CPU that processes that data, that raw data, and turns it into meaningful information that we can then transport anywhere because we have built a Web 2.0 platform around this amazing technology.
This is game-changing, isn't it?
It's completely transformative.
Disruptive, I think, is the right word these days.
Well, it's both. It's transformative and disruptive. There are, in this country, we have 15 million beds that are serviced by licensed providers. So that's hospital beds, that's SNFs, that's ALFs, and home care as well. But beyond that, there are more than 40 million people in this country who have some kind of chronic illness that impairs their activities of daily living. So what our system can do is to help all these people, in a really significant way, because the key is that we're generating continuous cardiorespiratory information. We trend that data, and that data is extremely useful in terms of decision support and basically identifying problems before they can really get bad.
Is it reimbursable?
So as a DME device, it will be reimbursable. In the hospital, it's part of the overhead cost.
So,
But
yeah.
But what it does is to increase productivity tremendously. In one study that we've done, we were able to save 15 hours of nursing time a day on a 36-unit ward, just in terms of the amount of time it takes to put leads on, take leads off, and the like.
That's significant right there.
That's right.
So
and that's just the beginning of it.
Now tell me, 2015-16, where's the company going?
So we're going to market right now in 2015. We have a very well-defined commercialization strategy that's focusing first on hospitals, but also on skilled nursing facilities and assisted living facilities. In skilled nursing, there's a compelling need because there's new legislation that was just signed into law that essentially imposes a pay-for-performance criteria on nursing homes, and that's measured in hospital readmissions. So with our system, if a caregiver inside a nursing home is monitoring the patient on a continuous basis, they'll be able to see whether there's a deterioration in the patient's condition and take action before they need to send that patient back to a hospital. That's a big deal.
Are you a manufacturer or are you using contractors? How does the product get manufactured?
So we're a contract manufacturer. We have a small manufacturing facility actually at Georgia Tech in an organization called the Global Center for Medical Innovation. We have a larger manufacturer who's actually based in Kentucky, and they're building units for us right now.
So why are you at SEMDA?
Well, I'm at SEMDA because we've done a Series A, and we're interested in identifying a strategic partner or a financial partner that will be able to support our commercialization initiative. That's why we're here.
All right, let's get a website.
www.sensiotec.com. That's SENSIOTEC.com.
Ladies and gentlemen, Robert Arkin, Sensiotec. It's a private company. I'm Shelley Kraft. This is SNNLive. We're at SEMDA, Southeastern Medical Device Association, 2014, right here in Atlanta, Georgia. Thank
you.
for coming on.
Thanks so much.
Good seeing you.
Good seeing you.